Now, there is another major concern apart from essentials, which is of health itself. That if a patient feels symptom, immediately to rush to hospitals is also an advice that has been given by experts to not immediately head to areas that may spread more infections. And therefore, many Indians are now approaching the option of telemedicine. I'm now joined here by Dr. Alexander Kuruvilla. He is Practo's Chief Health Strategy Officer. Doctor, thank you so much for joining us here on India Today. Now, Practo is also a telemedicine portal, and it does advise via registered practitioners. So for now, Dr. Alexander Kuruvilla, how significant is telemedicine? While Indians are approaching it, it is not still the most popular option. Many are not aware about it. How can telemedicine at this point help Indians, and has now even been given guidelines by the Board of Governors?
Telemedicine in India is not something new. It's been there for the last 2 decades. We have some of the best companies in the world providing teleradiology, telepathology, tele-ICU. They're all in existence for the last 20 years. And today we have some of the best IT platforms in the world all available in India. This country is blessed and has some of the best doctors and some of the best technology and some of the best telemedicine facilities. Unfortunately, all these today are islands of excellence. We need to bring all these islands of excellence today together. And the government of India has actually just released a policy which will only help this grow even further. The importance of this today is even more. Just consider this situation. We are talking about social distancing. After making that effective, we are collecting all the people who have signs and symptoms of flu, of bacterial infections, or of coronavirus into small areas, small rooms of OPDs, or medium-sized rooms of small nursing homes, or large OPD areas of hospitals, allowing them to contaminate each other and then go back home and then contaminate other people. Today, to safeguard our caregivers, to safeguard our doctors, to safeguard patients from each other, teleconsult is now available at the safety of the residence of the doctor, at the safety of the residence of the patient. They can actually connect to doctors across this country who are on the platform of various IT companies and discuss their symptoms and signs.
So Dr. Alexander, how can this be approached by the Indians? How will it be beneficial? Because many may not be able to trust the online aspect, even if it is with the best information and communication technology. So how can a patient who does not want to visit the hospital can consult a doctor via telemedicine?
So, I mean, the only impeding or the only negative thing I see today on teleconsult is the reluctance of the doctors themselves or the healthcare themselves to get into this new mode of caring for the people or providing health. If they can be more open, if they can use technology more, then this is highly beneficial for the people. And the only other impeding thing is inadequate assessment. A proper history taking can give you all the signs and symptoms for a proper treatment, but a good trained, registered, council-registered doctor would know immediately when and where to stop and send them to the closest doctor available or to the closest hospital that's available.
All right, Dr. Alexander Kuruvilla, now perhaps will be also a test for telemedicine. Is perhaps that future already here? And in the times of lockdown, are Indians approaching the aspect of telemedicine? Thank you so much for joining us here.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.